My name is Joel Corvera. I'm an aortic and cardiovascular surgeon at IU Health Physicians since 2009. Why did I become a doctor? Interestingly, I did not want to become a doctor when I was coming out of college, so I did investment banking for about a year. And then I kind of quickly realized that that really wasn't who I was meant to be. After I grew up a little bit, I realized that what I wanted to do was really help people, and medicine, or surgery in particular, was the most important thing. I found out after a while that I was just like my parents. Years of trying not to be like parents, you realize that you are just like your parents, and I wanted to help people just like they did. What do I love about my job? I love the relationships that I form with my patients. A lot of the patients that I have are long-term patients as I take care of aortic disease, and so I see them over years, and we get to form a relationship, and we sometimes have to operate and sometimes we don't, but it's the medical and surgical treatment that is long-term, and I love my patients, and I think we do a very good job taking care of them. What can you expect when you see me in the office for the first time? When you see me in the office, we'll go over the diagnosis that you have, and I'll go over a lot of the information on what the diagnosis is and what it means. I will be very frank with you, and I won't sugarcoat anything, because usually if you're coming to see me in the office, you probably have a fairly serious diagnosis that may or may not require surgery. For every patient, I always balance the risks and the benefits of surgery versus the risks and benefits of not doing surgery. And then together we can come to a decision as to what we need to do. We make this decision together. I essentially give you the information, I give you the background, but essentially you'll be making the decision as to how we go from there. What do I do when I'm not in the hospital? Well, I spend a fair amount of time in the hospital, but I like to spend time with my family. My family is the most important thing to me. And my wife is a surgeon too, so it's a busy, very busy thing. So the time that we have together when we're not working is very important.